Well, I think that almost any country can bring down rates of TB if they build the right type of program. So, for example, when you ask me, can Thailand bring down rates of TB? The answer is absolutely yes. So, for example, I mean, I hate to be overly simplistic, but we know for many, many years that people have not been searching properly. They haven't been giving treatment to everybody that needs it, and they haven't been giving preventive therapy. So there's 10 million people in the world that have TB, maybe more, probably more, and 3 million of them are missed, almost 4 million now because of COVID. So automatically, you don't even have to be an infectious disease specialist to say, oh, we have to find those 4 million people. How do you find them? So that's the search part. Well, we know that the best search method is having a highly sensitive screening tool, like chest x-ray. People say, oh, we can't do chest x-rays. Well, that's what was done in other parts of the world that brought down rates of TB. And now we have the benefit of having digital chest x-ray with computer-based reads. And so you don't even need a doctor present to know if somebody's at risk. Then you also need a really good confirmatory test. There are now genetic tests that can tell you if somebody has TB and if they have drug-resistant TB. So, we're really, really far along on the capacity to search better, but it has to be implemented. And you need to put systems in place. And so people say, oh, do you expect us to test everybody? Or maybe in a high-risk place you do test a lot of people. Maybe you do very high-volume screening. People did that in Karachi. The Interactive Research and Development did that in Karachi, and they brought down rates of TB in the regions where they were. So we know it works. Then the second is treat. The treatment has to be easy. It has to be the best therapy. It has to be the shortest therapy. So this means moving towards 4 drug regimens for TB and 4-month regimens for regular TB and 6-month regimens for drug-resistant TB, so that more people can get treated. It means diagnosing the disease in children. Right now, most countries find under 5% of children. And we know that in countries based on their population pyramid, you should be finding around 10% kids, maybe more in some places. So that means that improving diagnosis in kids. When there is a household that has a family, you have to go in and you have to screen the kids, you have to screen all the other people in the household, and then you have to treat them. So making sure that adults and kids are getting the most efficacious treatments. Finding them, treating them. And then the final thing people say is, well, what about prevention? Well, almost every country signed on to the UN high-level meeting that said that we were going to do prevention. Less than 1% of the population in the world that needs prevention is getting it. Preventive therapy has been shown to be highly, highly effective in bringing down rates of TB when used in conjunction with searching and treating. So basically what we have to do in this case is say, well, we have to screen people in households using some screening tests like IGRA, like skin test, the Mantoux test, anything that tells you that what the level of infection of TB is in the house, and then based on the amount of TB infection, you make a decision: do you treat individuals or do you treat entire households? And you need to have the drugs to treat them. You treat them with 1 HP, 3 HP, 4 HR. There's a variety that have been approved by the WHO and other people, other agencies. But basically, if you treat people who are at risk of progressing to TB, young kids, people with HIV, yes, but also other close contacts, you can bring down rates of TB. And this has been done in many places. You see this in Taiwan, you see this in Singapore, you see this in parts of Russia that have done it, you see it throughout the West. So the question about can you bring down TB rates in Thailand, the answer is yes, but it's got to be search, treat, and prevent has to be built in programmatically. For adults, for children, for migrants, etc. Each one of them is a separate programmatic category, but every one of them has to include the search, treat, and prevent.